I'm Dr. Kathleen Neville. I'm Director of Experimental Therapeutics at Children's Mercy Hospital in Kansas City, Missouri, and I am the principal investigator for the Pediatric Trials Network hydroxyurea study. So what I think is very special about this study and the Pediatric Trials Network, especially under Dr. Danny Benjamin's leadership, is it's really created a space where academic centers across the country and the NIH and the FDA all collaborate for the common good of children. It's been wonderful for me to see how all these entities can come together with a common goal of creating better lives for our children. But it's true, I really believe that. It's so often in academics, people don't work together, and so often people are so worried about their grants with the government, or historically maybe NIH and FDA didn't work together, and now it's a conscious effort to help study these medicines in children that people are using out there. Hydroxyurea, one of them. One of the other special things about this collaboration is industry, big pharma has to answer to their stockholders. So drugs like hydroxyurea and a lot of the drugs that are being studied in the PTN as part of the Best Pharmaceutical for Children's Act are old drugs, so they're not money makers. So there's rightfully so not incentive for industry to go back and study them, yet they're used all the time, so they need to be studied. And the fact that the government and academics has created this space where we can study these drugs, I think is long overdue and is commendable. The Pediatric Trials Network and NIH and FDA make a huge difference. In academics, it is so refreshing to see, and a lot of the credit goes to Dr. Danny Benjamin for bringing these top academic centers together in a collaborative fashion with the common goal of advancing these drugs. Children's Mercy Hospital serves as one of the core pieces of the Pediatric Trials Network. So I've had the honor of seeing up close how it works and the advances we're making with the hydroxyurea study and with the hydroxyurea study and other studies. And the fact that people can come together just for the good of children, not to make money off of it, not just for the glory of it, but for the good of children, is heartening and inspiring.
Yeah.